Today's April 7, 2025, and it's an unprecedented time in our history for a number of reasons. I'm going to talk about just a quick take on why this is a particularly unprecedented time for behavioral health, behavioral health care, and why we kind of need to pay attention to this space. So what makes this day particularly useful, perhaps, as a marker of this unprecedented time is what's happening in the U.S. financial markets because of the application of trade tariffs on our trade partners and also tariffs that they are then placing on the U.S. in retaliation. The U.S. stock market is in a bit of turmoil. Its volatility index, the VIX, is the highest it's been except for at its peak during COVID. So it's only been this volatile in the U.S. market one other time in the history of that index. We also see that the markets are declining, or there's a roller coaster effect happening in the markets right now. But essentially, the nation has experienced over $1 trillion or multiple trillions of dollars worth of losses in the market in the last week or so since these tariffs have come into effect. And of course, it remains to be seen, what will happen with regard to that. But we do know, and how this becomes relevant, the macroeconomic picture is only so relevant in behavioral health as it affects individuals and families and communities. And it does. There's a direct relationship based on numerous peer-reviewed articles and a tremendous amount of research that shows that when the social determinants of health, which are directly related to finance and the state of the nation's economy, are adversely affected, so too is mental health. Those two things go together. So when we feel less safe, when there are issues about feeling, access to housing and access to nutrition and access to the funds that we need to, pay for our daily lives, to care for our loved ones and ourselves, to send our kids to school, to plan for retirement, of course, all of these things are foundational to a sense of well-being. And when those are disrupted, by uncertainty within the economy or adverse economic events, so too is mental health. So we will see, rising rates of mental health disorder, substance use disorder, suicidality, if we end up in a recessive period, and if that recession is similar to other recessions that have happened in the past. So that's one piece of uncertainty, and the second piece, and this is where it gets that. So that is precedented. We've had recessions, we've had downturns in the economy before, and we know what happens during those times. And we also know the reasons for those. And we know the reason in this case, too, for the most part. It's understandable. Certain policies are indicating that we should take measures, and those measures are, having an impact on the market. It's understandable. The effects, however, are difficult, maybe difficult to deal with for, a lot of folks. So that's precedented. The unprecedented part, when it comes to behavioral health, is the effect of a dismantled SAMHSA. So while the economy is going through this period of turmoil, SAMHSA is also going through a series of changes. We know that about a week ago or so, SAMHSA was decimated. About 10% of its workforce was released, was let go. It may be that 50 to 70% of its workforce is reduced. Its budget was also reduced. Funding to SAMHSA was clawed back. Funding that was allocated for COVID relief that was allocated by Congress was clawed back. And this has led to real impacts in a wide number of ways. And I am not sure, I certainly am not aware of, many of the ways that that defunding of SAMHSA has impacted, programs and individuals, but we know some of them. We know that a number of people have lost jobs. A number of programs have been told to discontinue certain types of treatment provision. We hear about in local media where state programs that are funded with SAMHSA grants have been told to discontinue those services, or that their funding is in question, et cetera. So we really don't know yet the full extent about what the funding changes at SAMHSA will be. It's also the case that SAMHSA is fundamentally changing. It's reported that Health and Human Services is potentially dismantling SAMHSA and reorganizing its functions into different portions of Health and Human Services Administration. So it remains to be seen, where that will go. So that's kind of a second piece that makes this period a really unprecedented one when it comes through the lens of behavioral health and behavioral health care, is that we know that there have been times of economic uncertainty, but during those times, it has been the case that the government, at least since 2000 and probably before, has been providing funds to SAMHSA or the precursor of SAMHSA to help offset and address and research, mental health disorder. Another really important point to bring up is that within that SAMHSA perspective is the dismantling of the National Survey on Drug Use and Health. The organization within SAMHSA that is primarily responsible for researching and providing data about behavioral health statistics. When you look at rates of mental health disorder, rates of substance use disorder, overdoses, deaths related to these disorders, et cetera, that is provided by the very talented and experienced people of the National Survey on Drug Use and Health. And on April 1st, the director of that program and the data scientists who worked at that survey were let go. And so the question is, do we have that data being collected? Who is gathering it? How can it be accessed? What's particularly potentially onerous and scary about that is if we have data that's an agreeable bolus of data provided by the government that we can all look at and say, yes, this is the definitive, or a definitive source of data for this subject matter, which is very difficult, by the way, to source and collect and requires a tremendous effort. We can at least have a basis on which to make decisions about behavioral health spending and treatment and prevention and all kinds of other efforts to bolster communities and individuals. Without that data, not only does it become difficult to advocate for those resources, it becomes a little bit more difficult to even substantiate the idea that there's a problem. And that is frightening, is that if the data doesn't exist to say that there's a problem with mental health or substance use disorder or suicide or overdose, how do you argue that? It becomes perhaps more difficult to say, here is the evidence that shows that these are real problems that America is facing, and we need funding and thought and innovation and programs, et cetera, to address it. So again, it's a moment in time to take a look not only at the uncertainties that could lead to diminishing mental health and behavioral health in the United States in the coming months and years, but it's also an important time to understand the knock-on effects of the government reorganization and reprioritization of resources like SAMHSA that make this a truly unprecedented time.